Hello, if you're out there, you are a nursing student, a medical student, you are a physiotherapy student, or an occupational health student, please, this video is for you. All you just need is to watch this video till the end and learn various skills that can help you jackpot. When I mean jackpot, I'm not joking. So if you're out there, even if whatever career you're doing or you've had, if you're back in Africa and you feel it is high time for you to make a greener pasture for yourself, this video is for you. Watch till the end and please do not forget, come back here and thank me. I've put together quite a lot of OSCEs. OSCEs are basically exams that you need to write. Once you pass those exams, or more, you are good to go. You can work in Canada, US, any part of the world you want to work in. Basically, you need to pass those exams. And how to pass those exams, I've simplified it for you in this video. Come back and thank me, and good luck in your new journey.
We begin with the crucial introduction. Dr. Amara prepares to assess Samira's ENT examination skills.
Good morning, Samira. Today we'll be conducting an ENT OSCE examination. Are you ready?
Yes, Dr. Amara, I am. The first station, patient history. Samira must gather relevant information from Anna.
Please take a history from the patient. You have 5 minutes.
Good morning, Anna. I'm Samira, one of the doctors. What brings you in today?
I've had a persistent sore throat for the past 2 weeks.
Can you describe the pain? Is it constant or does it come and go?
It's pretty constant, and it hurts more when I swallow.
Any fever, cough or nasal congestion?
Just a slight fever the first few days, and a little bit of a runny nose.
Have you noticed any swollen glands in your neck?
Yes, actually, on the right side.
Time is called. Dr. Amara signals the end of the station.
Thank you, Samira. That's all the time for history taking. Now, let's move on to the examination itself.
All right. Next, the ear examination. Samira must demonstrate proper technique and identify any abnormalities. I'm going to examine your ears now. Please let me know if you feel any pain.
Okay.
Samira carefully inserts the otoscope into Anna's ear. She examines the ear canal and tympanic membrane. The otoscopic view shows a healthy tympanic membrane, pearly grey, with no signs of infection. The ear canal looks clear, and the tympanic membrane appears normal. Samira repeats the process on the other ear. Same findings on the left side. Moving on to the nose, Samira dons gloves and prepares for a nasal examination. Now, I'm going to examine your nose. Please tilt your head back slightly.
Sure.
Using the nasal speculum, Samira examines the nasal mucosa, septum and turbinates. The nasal mucosa appears slightly inflamed. There's some mild congestion. The throat examination follows. Samira uses a tongue depressor and light to visualize the oropharynx. I'm going to look at your throat now. Please open your mouth wide and say, ah.
Ah.
The oropharynx reveals red and swollen tonsils, indicative of tonsillitis. Your tonsils are quite red and swollen, with some white patches. This suggests a possible tonsillitis. Next, palpation of the neck to check for lymphadenopathy. I'm going to feel your neck now for any swollen glands.
Okay.
Samira gently palpates the neck, identifying enlarged lymph nodes on the right side. I can feel some enlarged lymph nodes on the right side, which corresponds with what you mentioned earlier. The physical examination concludes. That concludes the examination. Thank you, Anna.
Thank you, doctor.
Time for Samira to present her findings to Dr. Amara. Dr. Amara, the patient presents with a 2-week history of sore throat, mild fever, and runny nose. Examination reveals inflamed nasal mucosa and significantly inflamed tonsils with exudates. There is also right-sided cervical lymphadenopathy. I suspect tonsillitis, possibly bacterial. Good. What investigations would you order? I would order a throat swab for culture and sensitivity to identify any bacterial infection. Also, consider a rapid strep test. Excellent. And how would you manage this patient? If the throat swab confirms a bacterial infection like strep, I'd prescribe antibiotics such as penicillin or amoxicillin. I'd also recommend supportive care like analgesics for pain relief. and advise the patient to stay hydrated and rest. What are some potential complications of tonsillitis we need to be aware of? Complications can include peritonsillar abscess, rheumatic fever, or glomerulonephritis if caused by strep and left untreated. Very good, Samira. Your history taking was thorough, your examination technique was sound, and your differential diagnosis and management plan were appropriate. You demonstrated good knowledge of potential complications as well. Dr. Amara provides positive feedback, highlighting Samira's strengths. For improvement, remember to always explain each step of the examination to the patient beforehand to ensure they are comfortable. Also, consider including cranial nerve examination, especially in cases with neurological symptoms. Thank you for the feedback, Dr. Amara. I appreciate it. A new student, David, enters the examination room, ready for his turn. All right, David, are you ready to begin? Yes, doctor. This time the scenario is a patient complaining of hearing loss. David, please take a history and perform an examination. On this patient, Mark, who reports hearing loss. Hello, Mark, I'm David. Can you tell me more about your hearing loss? It started about a month ago. I can't hear as well, especially in my left ear. Is the hearing loss sudden or gradual? Is it associated with any tinnitus, vertigo, or ear pain? It was gradual. I have a constant ringing in my left ear, but no pain or dizziness. David begins the ear examination with the otoscope. I'm going to examine your ears now. Let me know if you experience any discomfort. All right. The otoscope reveals a normal right ear, but the left ear appears to have a cerumen impaction. The right ear looks normal. However, the left ear has a significant amount of earwax blocking the canal, which could be contributing to the hearing loss. David then conducts Weber and Rinner tests to further assess the hearing loss. I'm going to perform 2 simple hearing tests. First, I'll place this vibrating tuning fork on your forehead. Tell me if you hear the sound equally in both ears or louder in one ear. I hear it louder in my right ear. Now I will place the vibrating tuning fork behind your ear, then next to your ear. Tell me when you stop hearing the sound in each position. David performs the Rinner test, comparing bone conduction and air conduction. Dr. Amara, the patient reports gradual hearing loss in the left ear with tinnitus. Otoscopy revealed a cerumen impaction in the left ear. Weber test lateralized to the right ear, and Rinner test was negative in the left ear. I suspect conductive hearing loss due to the earwax. Good. How would you manage this? I'd first remove the earwax, either with cerumenolytics and irrigation or microsuction. Then I would repeat the hearing test to reassess.